Welcome to where we are learning the facts while exploring current health-related topics. I am Dra.Maloof, and today we're going to be talking about GLP-1s, especially since they are now being highlighted in the media again. So what is it that we really should know? Well, this is your health, your knowledge, your power. So just recently, the United States administration struck a deal with the two most prominent manufacturers of these weight loss drugs, Novo Nordisk and Eli Lilly. And so the article title is Price Cuts Help More Americans Start Weight Loss Drugs, but maybe not stay on them. So what does that mean? So when we end up taking a look at the weight loss drugs, Wegovy and Zepbound, Wegovy is going to be reduced down to $350 a month. Zepbound will be reduced down to $300 a month. Well, this is a great savings from where normally the individual would end up paying $900 a month or over $1,000 a month. The Zepbound will start at $300 a month for the lowest dose, but then it will increase. Why? Because Zepbound has to be titrated up, the dosage has to be increased, and so it will eventually go up to about $450 per month. So this is a great savings towards individuals who are paying out of pocket. However, there are still individuals saying that's not enough because it needs to have a lower price, because on these drugs, you cannot just take these drugs for a few weeks or a few months. Taking these drugs, it is expected that individuals will be on these drugs for a very long period of time. So the new prices, they mean that people without insurance will pay less out of pocket, which is great. But it may be enough to persuade some to switch from compounded alternatives sold on other platforms. So what does this mean? It sounds like these two manufacturers have lowered their prices so that they can end up having more individuals purchase their products as opposed to going to other platforms. So let's understand a little bit, what are these GLP-1s? What do they actually do? So when a person is hungry, when all of your glucose is gone, when you say you don't have any energy, you're fatigued, you are tired, you are sluggish, when you're hungry, what actually happens in your body? Well, your pancreas in your abdominal cavity, it is going to end up releasing a hormone, a chemical. What is this hormone, a chemical? It is called glucagon. Glucagon is released into the bloodstream, and when glucagon, this chemical formula, is released into the bloodstream, this hormone is released into the bloodstream, it floats throughout your blood until it comes to a receptor. That receptor, one of these receptors, just happens to be on your liver. The liver stores glucose. Your liver stores about 24 hours worth of glucose. And so it stores that glucose in a compacted form called glycogen. When glucagon binds to the liver, it stimulates the glycogen to be catabolized, to be broken down through glycogenolysis into individual molecules of glucose. And so now we go from a string of glycogen to individual molecules of glucose that are then going to be distributed into the blood. Once you get the glucose into the bloodstream, the person ends up feeling good. They feel as though they have the energy, and that is how the body works when a person is hungry. So what are these GLP-1s? Well, GLP-1, it stands for glucagon-like peptide. So it is very similar to what it is that we end up producing, the glucagon. This is a tweaked formula of that glucagon that is produced by the pancreas. But where does this glucagon-like peptide, where does this GLP come from? It comes from the small intestines. So everyone is producing these GLP-1s in their small intestines in small amounts. Every time you eat, you are producing these GLP-1s. So what is then happening when we produce these GLP-1s? Well, the GLP-1s, they will find their receptors, and these receptors are on the pancreas, on the stomach, and on the brain. And when GLP-1 binds to those receptors, the pancreas will increase insulin, decrease the glucagon. The stomach will slow down its gastric emptying, so food will stay in the stomach for a longer period of time, which means that the person's not going to be very hungry. And the GI motility is going to decrease, which means that there's still going to be a lot of the foodish content in those intestines. And to the brain, when GLP binds to certain centers in the brain, it causes the brain to register that it's not hungry. So the food intake will decrease and the water intake will decrease. So now that we understand how GLP-1 that our bodies produce ends up binding to receptors on different parts of our body, there are several of these GLP-1 receptors, and they're on multiple organs within the body. And so they have an impact on all of these different organs: the liver, the brain, the heart, the pancreas, the adipose tissue, the gut, the muscle, the stomach. And so what is it that ends up happening? Well, this is wonderful because we've got GLP-1. This is a master organizer, and it's going to help our metabolism. It's going to help our body organs to function. So why do we need GLP-1 agonists, these weight loss drugs, if our bodies are producing GLP-1 in the small intestines? Well, in the small intestines, when our bodies produce the GLP-1, the half-life for that GLP-1 is very, very small. It's from 1 to 2 minutes, and then it disintegrates. So as we are producing that GLP-1, it disintegrates really quickly within just a couple of minutes. These GLP-1 agonists that the manufacturers are producing, they can last within the body for 5 days, 6 days, 7 days, 8 days. And so this is what ends up happening when we end up having these synthetic formulas in the body. So how many people are actually taking this? Well, in the article, it mentions about 12% of the United States population has been on or has taken these weight loss medications. That's a significant number of individuals. So why are people then stopping taking these GLP-1 agonists? Half of the patients without diabetes stop taking the drug within 1 year. So individuals who have been taking these drugs for weight loss purposes strictly, half of them, 50% of them, will stop within 1 year. Why do they stop? Because of side effects. Why do they stop? Because some of them lose too much weight. Why do they stop? Because the expense out of pocket has been enormous for some individuals. Why stop? Because sometimes there was a supply shortage. And in some individuals, the GLP-1s, they were ineffective. The person was taking them, but they were not losing the weight. In approximately 15% of the individuals to Wegovy. So after 2 years, approximately 15% were still on the GLP-1, where that's a significant reduction in people who stayed on the GLP-1. Wegovy, approximately 24% remained on it after 2 years. And so when people got off of these GLP-1 agonists, those who discontinued the GLP-1, they typically gained most of the weight back within 1 year. So what is the downside of this social craze of GLP-1 agonists? A third of the patients, they stop these GLP-1 agonists because they feel as though they are starving. It interferes with the generating reward. So patients are reporting that they are becoming depressed when they are on these GLP-1 agonists. They are talking about suicide. So mental health is an important factor when looking at these GLP-1 agonists. And many individuals end up discussing having Ozempic face or Ozempic butt. So what is that Ozempic face? It is where these weight loss drugs, they are not just pulling the adipose or the fat tissue from the thighs or the abdomen. They're pulling the fat tissue from everywhere in the body, including the face. And it is that fat that is in the face that gives a more youthful look. So for an individual who is 35 years old, you can see the large fat pads Age 45, the fat pads reduce. Age 55, it reduces even further. This is the natural progression of reduction of adipose or fat tissue. With Ozempic, it accelerates that. So a person who was 35 years old, instead of in 20 years, them having a reduction in significant quantities of the fat in their face, it happens within less than a year. So, what are these side effects of GLP-1 agonists? There are common side effects, there are more serious side effects, and then there are contraindications. The contraindications, these are individuals who should not be taking these GLP-1 agonists at all. For the common side effects, we have nausea, vomiting, loss of appetite. You end up having paralysis of the stomach, paralysis of the intestines. And so food that normally would have been digested and pushed through within a few hours, within a day, it'll stay in there for 3 days. It'll stay in there for 4 days. And so after food has been in an area for 3 or 4 days in a warm body with microbes in there, with bacteria in there, things will start fermenting. And so gases can be a result of that. There is diarrhea, dizziness, bloating, fullness, mild tachycardia where the heart rate is elevated, headaches, indigestion, depression, less enjoyment of eating, and lean mass loss, both from muscle and bone loss. More of the serious side effects would affect the pancreas. Pancreatic cancer has been noticed, especially in the laboratory. Abdominal pain, bowel obstruction, bile duct blockage, thyroid C-cell tumors in the lab rats, jaundice, and once off the Ozempic, some individuals still have not recovered from the paralysis that occurs to the stomach or the small intestine, and then vision loss. So these are some really serious side effects. So how can we end up reducing these side effects if a person is going to be on these weight loss drugs? Well, it's important not to start off with a very high dose. It should be a gradual dose increase, and also following a low carbohydrate, high good fat and protein diet. Those micronutrients, vitamins and minerals are very important. And then get physically active. Get into a program where you are walking with others or walking, enjoying sports. Be physically active. Water aerobics. This will help to prevent the muscle loss. And then enroll in a support program to help change the behavior and to help change the diet with guidance and support. Psychological support is very important, especially for the mental health, as these medications can end up altering some of the brain activity, and monitoring the blood work and monitoring blood pressure, heart rate, and glucose. So, GLP-1 agonists, magic pill or magic shot? They are not. However, these GLP-1 agonists, there is benefit, especially for those individuals who have type 2 diabetes mellitus. For individuals who are thinking about taking this for weight loss, it requires lifestyle changes. These GLP-1 agonists, they require that the individual is physically active to maintain lean mass. It requires that the individual is going to eat nutritious foods, and it requires that the person addresses psychological barriers. So thinking about these GLP-1 agonists, think of them as a tool to aid the body managing blood glucose levels. Think of them as a tool to aid in weight loss and management. And as with everything, there are costs associated. So wherever you may find yourself, you can always improve your health. Stay healthy, well, and informed. I am Dra.Maloof, sharing knowledge to empower you. And if you would like, feel free to subscribe and like. Until the next time, stay healthy and well. Take care.